Have you been wondering if you or maybe a family member has endometriosis? As a pelvic therapist, I am surprised at how many patients come to me with, to me, what is very clear history that we should be highly suspicious of endometriosis, and yet they've never had that diagnosis. My name's Nari Clemons. I'm a certified pelvic rehab specialist, and I'd love to take a few minutes today to talk to you about what you might be looking for in yourself or a loved one when you're wondering if endometriosis is at play. First off, what is endometriosis? In a person who is assigned female at birth, they are generally born, in most cases, with a uterus. Inside that uterus, when someone hits their reproductive years and starts having cycles, that lining will swell every month, and that tissue that swells is called endometrial tissue. So the endometrial tissue will swell every month, and then it sheds at the end of the month and it leaves the body, obviously through the vagina. Now, what happens in endometriosis is those endometrial cells that swell every month in response to hormone ended up outside the uterus. Now, there's a lot of theories about why this happens, but the most compelling evidence we have right now is not this old idea that that tissue somehow traveled up through the fallopian tubes and squirted out into the abdomen. The theory that makes the most sense to us now scientifically is that those cells have been there since birth. Now, it's kind of like cancer cells. Almost everybody has had cancer cells in their body, but their body detected it and fought it and got rid of it. In some women, when their tissues are migrating as they are developing embryologically, some of this endometrial tissue ends up outside the uterus. And then their body also didn't clean it up. So what we see with many of these patients is they have no symptoms during their childhood years. But then when they start having periods, every month that tissue that's outside the uterus is swelling, it's growing, and it's bleeding, and then it's leaving sticky blood outside the uterus in a place it doesn't have a place to leave or a way to leave. And so then that tissue becomes sticky. It forms what we call adhesions. Now, what are adhesions? Adhesions are when you have two organs, like the bladder and the small intestine, and one is supposed to move over the other when you bend forward. Or the bladder, and then the uterus is behind it, and the rectum is behind that. And these things that should be moving separately form little connections. Now, that doesn't sound that scary until you think about the fact that the uterus has to contract to push that blood out every month. But if it's trying to contract and it's stuck to the bladder, or it's stuck to the rectum behind it, or it's stuck to the small intestines around it, then you're going to get very severe cramping. So now I'm going to go through why these symptoms come up, often in early adulthood, when someone starts mensing, and what we could look for. So remember how I just said that the uterus can stick to the small intestine and there can be adhesions there. And then every month, those swell, those bleed, they get sticky in the area. Now there's more cells in the area, so the next month it's a bigger process. And the next month it's a bigger process. One of the first questions I always ask people when I'm suspecting endometriosis, or if we're suspecting it in a young woman, is, did you start having digestive issues that seemed like irritable bowel syndrome, cramping, bloating, constipation that was severe, abdominal pain? Did you start having these symptoms within a year of your period starting? Because remember, if those were there since birth, they wouldn't have been creating a problem until the hormones hit them. So did you start having digestive issues within about a year of your cycle starting? The second question I have is that getting worse? A lot of these patients will say, well, it must not be endo because I went on this really low inflammation diet or this vegan diet, or I cut out all these food groups and then my symptoms didn't seem as bad. But if you didn't have to do that before you became of mensing age, and then you had to do it after, that is one of our big warning signs. Another thing that people can report, another symptom, can be painful periods. Now, I'm not talking, oh, it hurts a little and I have to take a little Advil. I'm talking people are missing school because they're in so much pain. They're laying in bed crying. They're on the floor in a pile. They cannot function. Now that pain could be in the uterus, in the low abdomen itself, or it could also be in the low back. But it's often an extraordinary amount of pelvic pain with periods, and that pain tends to grow and intensify in time. Now, that pain grows in two ways. One way is that pain can become more and more intense in time, but the other can be the number of days that you're affected during the month tends to grow. So maybe it starts when somebody's having a really painful period for 2 days. Then after 6 months, they're having a painful period for 3 days, but they're really sore for 2 days before and 2 days after, and they're starting to have more irritable bowel. Now we go on another year down the road and they're having more problems with like gas, bloating. They call it the endo-pregnant belly because people can literally look pregnant at times of the day when they're not. So the bloating symptoms tend to increase over time, not with everybody, but also the number of days that they're troubled during their period, that can also tend to grow. Another thing we might see is increasing back pain or pain running down the front of the legs or the back of the legs. People might start to have pain with prolonged sitting because the ovaries, which is one of the sites where endo tends to be, is really close to the inguinal ligament, and the nerve that supplies the front of the leg and that gets blood supply in and out of the leg, which is called the femoral nerve, the femoral artery, and the femoral vein. If you start to get adhesion in that area, those can get compressed with prolonged sitting. Some people also start to develop more vaginal pain, and they start to develop more pain with sex sometimes in time too, because the nerves and the organs above the area are affecting what's happening in the area. And because of that, pelvic therapy to stretch the pelvic floor muscles may help with some of those symptoms, but the real work has to be done up in the abdomen. You really want to have visceral manipulation done to help with those and some neural decompression therapy done. One of the other things we see as a really common part of the history is cysts. Rupturing ovarian cysts or a history of ovarian cysts. Women who have endometriosis are 3 times more likely to have a history of ovarian cysts. So to me, when I'm reading through their history and they talk about a cyst that ruptured and how painful it was, and then maybe they're talking about some irritable bowel, I'm really starting to wonder if this is the case. And the last thing I like to ask people to sort out in their history is, do you have a mother or a sister that also had these symptoms or that had to get a surgery for endometriosis? If you have a mother or a sister with endometriosis, you are 6 times, not 6%, 6 times more likely to have endometriosis yourself. So if you had a sister or a mother who has dealt with this disease or had these symptoms, this could be a big warning sign. And the problem with this is sometimes people just think, oh, that's just how it is for people in my family. But sex should not hurt. Sex should not hurt. Your periods, is it normal to have some pain, like where you have to take an Advil or 2? Sure. But the kind of pain that's making you miss school and miss work, worsening irritable bowel over time, having so much bloat that you look like you're pregnant, having difficulty and pain with sitting. I remember a couple of the young teenage girls I've seen with this, the symptoms they came to me with was they couldn't sit in class or stand in gym class for long enough because they were having so much pain down their legs. And so to me, that cued me up that there's probably some kind of endo happening around that. Now I'm gonna make some other videos for you guys on like what's the best kind of pelvic therapy for endo, what should you look for if you're looking for a surgeon, what kind of outcomes do I see when patients follow the protocol that I have them follow, and just things like that so you can educate and empower yourself. So for more tips and tricks, if you wanna keep learning about that, just hit that subscribe button. Thank you.